I think the first thing that happens when you hear a bad diagnosis is shock. And after that, you just get flooded with emotion. And I think we wouldn't be human if we didn't let ourselves cry. Whether that's publicly or privately, we have to give ourselves that moment. Then when the moment passes, we need to collect our battle gear. And that battle gear involves a couple of things. First thing it involves is to collect all the people who are going to be your support people. Second thing is arm yourselves with as much knowledge as possible. You are the leader here. You need to be the master of that information. And the third is to pack your bags with positivity, because you're going to need a lot of it. First step is to know what we're going into and ask questions. Don't be afraid of asking questions. Ask whatever you need to ask. The second is to be mindful. Be mindful of your support group. Be mindful of the providers who care for you. Be mindful of the nurses. And probably the most important is to stay positive. So at the root of it all, it's really positivity, knowledge, and being mindful and respectful of everyone around us. Once we've gone in with the knowledge of what we're walking into and building upon that knowledge, really, we have to be proactive in thinking, how is this going to change my everyday? Sometimes, unfortunately, as a physician, we think around the treatment. And we sometimes don't think past that treatment because we're not going to be going home with you. But what you really need to think of is, how is this going to really change my everyday life? And so really take a look, before you ask any questions, take a look at what does my everyday life look like? And start asking, how is this illness going to impact my everyday life? And frame all of your questions around that. The best approach is to, of course, be patient with yourself, because there are changes, but never accept this thing called new normal that a lot of people will throw at you. I personally hate that phrase, because the minute you start talking normal, there's nothing left to strive for, and we always want to keep striving. And once we get that framework, then at one point you're going to start thinking, wow, I can actually help someone else, and I can help pay it forward. And that's really when we all come to the realization that I love, which is life is a canvas, and we can't control always the color palette, but we always hold the brush.